Hey, everybody, welcome to Meddkit's Provider Spotlight, where every week we are interviewing the most amazing private practices from all over the United States. And every week we're meeting not only someone new, but getting brand new perspectives, hearing about their experiences in private practice and what they're doing and how they're helping their communities. And so today I have a really awesome special guest for you. I have Dr. David Felipe. He is the Vice President of Clinical Operations at SFR Physical Therapy in Miami. Welcome, David. So nice to have you.
Great to be here.
Yeah, I'm very excited to dive in. I know that we have a lot to get to today, but I really love to start this off with really getting to know you. I think that's what everyone is dying to know. Who is Dr. David Felipe? Who is he? What does he do? What's his story? So I would love if you could start us off with, your why. Tell us your story and what maybe inspired you to get into physical therapy.
Like many other clinicians, I was an athlete my entire life growing up. I
Mhm.
spent most of my time playing baseball, football, lacrosse, and ended up playing collegiately in Division III. It was a small little liberal arts school called Guilford College. And throughout that time, I just often, like many athletes, was spent a lot of time in a training room. I was battling between, the athletic training profession and the physical therapy profession. And I just thought that you know, when you become an athletic trainer, for me, I really wanted to try to be able to reach a larger population of people and not just athletes. Because, doing observation hours in college, I learned that like working with the geriatric population is rewarding and it's a population that a lot of people just kind of, I feel, neglect. And, there's a bunch of people that need help. And I went down that road and the rest is history. And now I'm here and
That
luckily I had this opportunity to be at my practice and treat everyone.
That's awesome. I love to hear that. And yeah, I think you bring up a unique perspective of, being raised as an athlete and the trials and tribulations of that when you get injured, or you're in there working out to be the best that you can be as an athlete, but then seeing the other side of things. And maybe I don't know if you've grown up with some elderly folks, but it's such a blessing to be able to take care of those that are a little bit of an older generation, and I think equally have a lot to learn from them as well. So that's really sweet. I love your story and your why. But if maybe you could tell us a little bit about, I know as a physical therapist, there are probably some common areas that you treat. So I'd love to hear about,
Yeah,
and but I'd also love to hear about. I always think there's more than what meets the eye, and
yeah.
there's so many things that people I think wouldn't think physical therapists can do for them. So maybe there's some uncommon or like, hey, I had this crazy situation and I treated this person. This was kind of one in a million, but here they are and we had the ability to help them get better. I would love to hear kind of some of those scenarios that you have.
Having joined this practice, it was primarily a sports specific therapy, physical therapy practice. We predominantly dealt with baseball players and baseball athletes from youth to professional. And through COVID, obviously, sports were a little tough and physical therapy as a whole just was under a lot of stress just trying to find patients. A
Mhm.
lot of the elective surgeries that we were our bread and butter, knee replacements, hip replacements, were kind of pushed back. Those surgeries weren't occurring. So we made it through COVID, and we kind of took a step to just realize there is a greater scale and a larger population of people that we could serve. And one predominantly in the last couple of years that we've really jumped into and have started treating is vestibular health. Um, and I think the biggest thing there is there's such a massive misconception, and it's something that only affects the elderly. Of course, there is, you know, predominantly most of the patients that we do see are elderly,
Mhm.
and have different degrees of vestibular disability, but there's a lot of younger people, people in their 30s that I've seen, 40s that active as, anyone else, but do end up having these issues. And, they're like, I was so afraid, so tentative to come to therapy because I'm like, I'm too young for this. That's something I hear all the time is, I'm too young. I'm not old. Like, why am I having these issues?
Mhm.
And it is something that, If we get these patients in the door a little quicker, obviously the rehab can progress a little bit. We can get whatever symptoms they have under control a little faster. But yeah, that's probably one area that I see a bunch of people just kind of a big miss.
Yeah.
And I think we try to tackle, luckily, a little bit better than most people because we do see a bunch of these athletic people. I see tons of runners and like, hey man, I've been having this random dizziness lately. And I'm like, have
Mm.
you ever gotten it checked? Have we ever done so we're trying to educate those like 30 to 50-year-olds that are having these symptoms and kind of just like neglecting it.
Yeah, we're a
But
little stubborn, aren't we?
yes, yes,
Yes.
yes.
Yeah, yeah. Well, you bring up an interesting, topic, and I think there's, like you said, vestibular health is something that I wouldn't exactly classify like, oh, I'm right in my mind. I'm going to go see a physical therapist about that.
Yeah,
That is so cool to know because I think, like me, a lot of people wouldn't know that, or even also providers. There's often
yeah,
things that we forget who are great referral sources. So it's great for the providers who are listening to be like,
yeah,
oh, yes, this is something that I can go and direct my patient to, and I forgot this corner of healthcare can help with this. And so I think that's a really cool item to speak about, but. Is there anything else that you would say from other common things, maybe for like the athletes too? It seems like you're seeing a lot of, middle age range folks. Is there a lot of like injury in terms of athletes?
oh yeah,
Yeah.
yeah.
Mhm.
So for us, obviously we're in South Florida, so the majority of kids here play baseball.
Yep.
um we see other sports, but ultimately, I went to school in North Carolina, so I have, a large part of my friends that are scattered across the Northeast.
Yep.
They grew up playing 4 different sports.
Yep.
We
Sure.
had to move indoors because of snow, you know. Um, and here we have the luxury of having sunshine and palm trees 365 days a year.
Mm.
So kids, here get exposed to, or get told that if you really want to excel in your sport, you got to play the same sport at a very young age the whole year,
Mm.
which now we're seeing in research isn't necessarily the case, because what happens is these kids end up start training their muscles and their joints and overall themselves in one particular way. And then we run into these issues of overuse injuries, of little league shoulder, little league elbow, where it's just because they're playing too much of the same sport. And then we also see that in, higher level professional athletes, a lot of them played multiple sports growing up and didn't really specialize till they got to later in their high school careers, you
Yeah.
know. And it's a very hard conversation to have with a parent,
Mm.
because you see parents and they're like, no, I want my son to be the best. I want them to be the next big leaguer. And, it's really just trying to break down and get them to digest the fact that, they're kids. They need to be able to play different sports and get their bodies accustomed to a couple different movements, which ultimately will overall help them in the future. You
I
know,
love that. Yeah, that's a great like very rational way to break that down. And I think to other kids that aren't, or parents or physicians that aren't in the
mm,
South, maybe don't even recognize that yes, you get sunshine all the time. So people are playing and doing things outside, being very active, a very active population, while also having an older population too, being in Florida. But yeah, I can really understand, the common folks that are coming in with a lot of like that overuse injuries and things like that. That makes a ton of sense. But very interesting perspective to hear about in terms of the athlete and what they have to go through, and what you have to go through on, the clinical side of it, and trying to
yeah,
explain, hey, yes, we can get your kid to a level, but you might, you got to be careful. This is the marathon, not like the sprint, of the sport. So that makes a lot of sense. And and the way you're speaking about things, I'm learning a little bit more about your approach as a PT. But is there anything else that you would like to add in terms of how your approach is different, in terms of how you approach a patient, or how you approach um your outlook on how you
yeah.
want to, do things?
So, probably in the easiest way to explain it is,
Mhm.
when I was in PT school,
Mhm.
I was doing my rotations and I had the opportunity to do my rotation at SFR Physical Therapy, where I am now.
Mhm.
And before joining the team, I was obviously, you're learning what kind you want to be.
Mhm.
And I had time to do some rotations at some bigger entities, and see that kind of formula to how they treated patients. And when I got here, it was an entirely different thing. It was a family-owned business. The husband and the wife, were working here. All the employees got treated like family. And, that was almost 5.5 years ago, and I'm still here. And, we still have that same kind of core where we have patients that'll come in, you know, once.
Mhm.
And then a month later, I brought you my daughter. I brought you my grandfather.
Oh.
And it's a very family oriented kind of place. It's a lot more personal,
Mhm.
which I think we have the luxury because, the management and the so-called higher ups are very involved. Like we're here. Um, what you see is what you get. And it's not so much like we typically try to take a little more time. I
Mhm.
guess it's just also the Hispanic culture. We like to dive a little deeper into, hey, how's your life? How's your family?
Yeah.
Where patients can get that kind of interaction where it's not just, "Ugh, I've got to go to PT. They're going to, you know, bend my knee and it's going to hurt." You know,
Yeah.
the amount of patients that we have that just, I don't know how I haven't gained 500 pounds. The amount of patients that bring food, cake, cookies, especially this time of year with Christmas, they treat us like family, and we do them. So I feel like that's always our approach. I try to view every patient as, they're my relative. Like, how would I treat my mom if she walked through the door? How would I treat my father if he walked through the door? And, you know, luckily we have that ability to, like, we don't have as strict time constraints as some other places where in
Mhm.
an hour you're out. Here, if I want to chat with you an extra 10 minutes and it's going to make your day and it's going to make a lot of these patients feel a little better, a lot of people are going through things that sometimes they just want to talk about. So, we do play a little bit of that, you know,
Yeah.
therapist on another level. So,
Yeah,
you know,
get all the therapy. No, but I mean that's really great because, I think oftentimes, some of the medical community can get this part wrong. And they are under time constraints and numbers. And I get to some extent that that is a thing. But I think a lot of things are missed because of the lack of conversations. And I'm sure that you can pull on a lot of diagnoses or figuring out what's wrong with someone just by listening to them more because they're telling you about their day to day and you're like, I don't know if that was the best thing for you to do yesterday. After hearing what you did, maybe let's try to do this differently, the next time. So I think there's things that you can probably figure out just by getting to know people more, and whether they maybe work from home and you're hearing about their work situation, and they're not taking breaks, and so but yet they're having terrible pain, sciatic pain, and you're like, well, you're working like a dog, and I think you could use some stretches in between. But you would have never known that if you didn't listen to them, right?
yeah, like, and I think it's like we talk about building rapport with patients,
Mm-hmm.
and it is truly at its core probably the most essential part. Like,
Mm-hmm.
you can be a great physical therapist, you can know what to do for every diagnosis, but if you're not getting a patient to truly be completely honest with you, because a lot of the times you could have a patient that comes in and says, "Yeah, I don't know why my knee is swollen."
Yeah.
Okay, I know you had surgery recently. What did you do? I didn't do anything. Whereas if you've built that rapport, you've got that great relationship with your patient. Hey, I accidentally went to the mall and was walking around for like 3 hours yesterday. Okay, that probably wasn't what I would have recommended you to do, but you can truly get to the core of any kind of issue that arises during therapy. You know, and sometimes it's just about treating people the way you want to be treated.
Mm-hmm.
Like, I get it. We have ultimately a business to run.
Mm-hmm.
But when you build that relationship with a lot of these people, you can get like we survived, and I know our owners survived a long time with just word of mouth, with
Yep.
just doing a good job, having other people refer to us. And, now it's a little different. Luckily, we have, a lot more referral sources, but it's still a great avenue. And it's still awesome to always have someone come in. Hey, do you remember so and so? They told me you did a great job with them 2 years ago. And I reached out to them and they sent me to you. So,
That that is so nice. Word of mouth is the best compliment, I always say.
yeah.
Um, I'd love to tap into something that you had mentioned earlier, with vestibular health, and you mentioned the word misconceptions, which is probably my favorite word. Most people, I would say maybe a little bit afraid, but I know you aren't, David. I think every specialty is plagued with a misconception. So you debunked one already today about, I don't think a lot of people would know that you can see me for vestibular health. However, I think, people might, and you said things about, oh, like PT, some people might think I'm just going to bend their knee, it's going to hurt, and, it's not going to be a great time coming here. So
Yeah.
that your approach, you broke the ice on that one. I would love to know if you have any more misconceptions of, in this day and age, with technology and AI and ChatGPT, people are really, which is in some part great that they're getting a little bit more invested in their health. They're researching things, they're looking up maybe certain diagnoses, but as you know, you can't always believe everything that you read online. So I'd love to hear a little bit about some of the misconceptions that you think that you are plagued with as a physical therapist, and what would you like people to know and debunk for once and for all? What would you like to get out to the folks here?
Oof. Okay. Yeah, I think a large thing that, there's two sides of the spectrum. We have some of the patients that are very, all right, I'm going to Google everything. I'm going to chat GPT everything because I think I can fix it. I think we can fix it with physical therapy. I don't need any help from anyone else.
Mm-hmm.
And that side, I feel like, is the lesser of the evil, where it's like, okay, I may have to redirect you a little bit with what you've been reading.
Mm-hmm.
You've got an idea, which ultimately, when I have an issue and I don't know about it, you know, it's not bad to Google something if you don't
Yeah.
know anything. But to know that, yeah, you're Googling it. There's tons of stuff out there that you may not be accurate. You don't know who's putting out that information. So there's that side. And then there's the side of where we have all these people where there is this kind of overarching, like, kind of structure to how people view healthcare, where it's, I need to go see this doctor to send me to this doctor. Whatever that doctor tells me is what's wrong. And then I get the patient and I'm, you know, trying to navigate that situation where it's like,
Mm-hmm.
okay, look, you may have this going on. They, but it may not be the only thing, and trying to get people to understand that, we can be a access point to health instead of
Mm-hmm.
just prescribe. Like sometimes I think people view physical therapy as a drug almost, where it's like, hey, I got a prescription for you. Whereas it's technically a referral, like they have this idea where it's, hey, this paper, and it's just a generalized referral is saying, checked all these boxes,
Mm-hmm.
and that's all I need. Where it's not really that, like we've dedicated, a lot of time as a profession to try to get a lot more rights and a lot more autonomy in what we can do and how we can truly help people. And I think trying to get people to understand that we are a lot more fit to kind of come up with some of these musculoskeletal issues
Mm-hmm.
and kind of problems that people are running into. Whereas, like any other profession, it's a specialty. Um, and then when it comes to human movement, we have, you know, a very specialized view of how the body moves and how it should be working. So
Mm-hmm.
I think sometimes trying to get that patient to know, hey, look, the internet I know told you this. When it comes to how your body's working, you're at the right place.
Yeah, I love this question because I think everyone answers it very differently. And even doing hundreds of videos over the past 5 years, I
Yeah,
can almost say that everyone has answered this just slightly differently. And I love your take on this because I didn't put into perspective that, some patient already got a diagnosis maybe before they've come to you. Um and it's not like you are trying to disregard what that other person has said, but as a specialist in this specific area, there could be other things going on. And so, and you have to play that dance of, hey, I'm not discounting your doctor, but there's some
yeah,
other things at play here. And these are some of the things that we should and need to address. Alongside of this, this isn't the only thing that is
yeah,
causing this. And so, um, and I can understand, just hearing you speak about how sometimes people do treat physical therapy like a drug, like, oh, I'm going to go here from this, gets fixed this,
yeah,
and then, move. Yes, as you're saying that, I've heard, and I think a lot of people listening have kind of heard, whether it's a friend or family member go through physical
yeah,
therapy and they're treating it as such. And I really like how you debunked all of that. I think that was really wise, and I think there's a lot of things that we're doing subconsciously as we're going to see physical therapists without even understanding that mindset. And so thank you for bringing that up. You're like the first person to ever say that, and
yeah.
I think it's a really unique perspective to have. Yeah. One that we should all be really reconsidering, especially, you called out some of like the middle-aged folks, and like, yeah, I think, I'm sure those people maybe have become a touch more stubborn, as
Mhm.
I think maybe we all have, as we've gotten so much access to information. And so we've all gotten maybe a little bit more stubborn. It's not like, we're going back 50 years and the doctor told you this, and so you're going to do it. I think with our knowledge, maybe we've created a little bit of an ego that really shouldn't be there for ourselves. And we should be listening a little bit more. So, great thing to touch on. And to kind of round things out today, I would love, you've given us so much to chew on in terms of misconceptions, how you're helping people in your community, and your approach. But I'd love to hear, maybe if you can give some tips, kind of a two-pronged question. I'd
Gotcha.
I'd love to hear pro tips, one for getting clinical and non-clinical. So for the people that are clinical here, I would love if there's something that you do within your practice every day that you think other providers should know about, something that's really important for them to know. I think whether you're new in practice or you've had your practice for 30 plus years, I think we can all learn new things from different providers. So I'd love to hear your pro tip for them, but I'd also love to hear a pro tip for what you might say to a new patient or client, something to move our health in a better trajectory. I think there's always something little that we can pick up from each conversation, and something new that we can adopt into our routine.
Yeah. So in terms of to your first question, I think I am still very, very new to this. I recently became a partner about 2 years ago.
Mhm.
So I think my greatest challenge in becoming a partner and truly diving into the financial aspect of the business part.
Mhm.
And it's understanding where we still have to tightrope that concept of this is a business, but how do we not sacrifice our core values, which, like I've talked about, is trying to view patients as family, trying to keep that home like feel to the way that we provide therapy, but yet expand. And something that we've been doing is trying to grow our our reach, and we've opened up another office. We're planning on opening another in January, and trying to make sure that we get the right people that match our values, that kind of have our same work ethic. Luckily, in our profession, in healthcare, we have the ability to get students, and we have several relationships with the universities around us where you know it's like it's essentially, yes, we get to teach these students, but it's also an interview.
Mhm.
We get these students, for 8 to 12 weeks. And in that time, you can truly develop relationships. So we've had a lot of opportunity to hire kids that have been our students and have, seamlessly fit into our model and how we grow our practice. So I think overall as a health as in healthcare, I think the biggest thing for all providers and business owners is trying to it's harder than you think, but try to really avoid sacrificing what makes you different to just make more money. And ultimately, I'm always want to make more money. I feel like that's everybody's goal.
Hmm.
But how can you do it in a way where we can still best serve people is ultimately the goal.
Yeah, that's really important. I love that sentiment. I think your values are, your
Yeah.
compass, your steering wheel to the ship, and without that, you're lost at sea. And then you don't go anywhere because your values and everything is lost in the middle of the ocean. So you have no direction. And I think um, you know, we are doing the same. Yes, everyone has to run a business and do all these things, but it is important to lose sight of why you started this in the first place, the oath that you took to help other people to the best of your ability. And so I think that's a really wise thing to say to providers. And I think it's important for people that are definitely just starting, but it's very important too for the people that have been in their business for 30 plus because as the years go on, I'm sure, we can get a little bit jaded and you're like, oh man, like, maybe you just had a rough year or something. And, it's tough. It's easy to lose sight of that at times. Yeah. So I like that very much. Very wise. And what would you say for the patient side of things?
Um,
Is there something that we can all do to better our health or just thinking about movement in a specific way? You've given such great debunks to the misconception. I'm sure you have lots of pro tips for us.
yeah, so I think I would say that the biggest thing and issue I see nowadays, especially just with patients and the world is we get people that are stuck in these loops of I'll get to it,
Mhm.
and it may be, washing a car or whatever, what you have you, but then a lot of the times it's I'll get to it in regards to their body and their overall health. I have patients that'll come in and they'll be like, I've had this right shoulder bothering me for months. I just haven't had time.
Yeah.
And ultimately it's just we have to start prioritizing our health and how we take care of ourselves. It's a small sacrifice, but ultimately, instead of spending 3 months with me, it's a month. And just getting people to start to see that you only get one body. We can have shoulder replacements, we can have hip replacements, but at some point, we really have to start trying to just prioritize our health, because as a society, like we've seen, we've got a very large older population coming with,
Hmm.
this generation. So getting those people to start really prioritizing their health, not just with going to see their primary, but overall their joints, like not neglecting activity, exercise, because ultimately it's going to help them. We see in research that there's active populations are at lower risk for, cardiovascular disease, joint replacement, all these different things where if you just don't neglect yourself and you put yourself first, not selfishly, but if you do put yourself first, you can really overall improve your health. So I think to all those patients out there, if something's bothering you, don't neglect it. Don't let it fester. Just try to take care of yourself.
I couldn't agree more. I think oftentimes we get busy and, we just want to move on to the next thing. But it is, before something actually gets worse, and it doesn't have to be worse, just go get taken care of. And I think we often wait for that rock to be crashing through the glass house before we take a move on things. And so I think we can be better at that. So I agree with you, David. I think that's some wise advice, both for not only us non-clinical everyday people. But some great advice too for the other practice owners and leaders that are listening as well. So I really appreciate all of the pro tips, fun facts, misconceptions you have debunked today. It was Awesome to get to know you. But before we leave off today, if folks here would like to get in touch or do a little bit more research on you guys themselves, what is a good place to come and find you guys and get some more resources?
So honestly, the best place to kind of be able to reach out to us is through our website. It's southfloridacenters.com. We also have a pretty active social media on our Instagram at SFR underscore physical therapy.
Mhm.
You can reach us out to us if you have any questions. Feel free to DM us. Our contact information for our front desk is also on there. Um, and any issues you guys have, we'll be more than happy to help if you're in the Miami area, that Homestead area.
Awesome. Well, we appreciate it, David. And this was terrific. And I hope we have you on again very soon.
Appreciate it. It was a blast.
Same here.